Now, using our 3 steps, let's break this down. This question is asking for acceptable patient identifier for the key problem you're preparing to give meds. So guys, we're just thinking the 5 rights here. Before you look at the options, we're thinking 2 pieces of identification to identify that patient. So the best solution we're looking for are which items are the best way to ensure you have the correct patient here. So option number 1 isn't correct here. Guys, age is not the best way to ensure you have the right. Now, using our 3 steps, let's break this down. This question is asking for the priority action, or nurse's priority. For the key problem, an unresponsive patient with no ID, no family, who needs surgery. So the biggest thing I'm thinking here is preservation of life, or life-saving measures. So our solution here are what actions to avoid the worst potential outcome for this patient. How do we keep this patient safe? So option number 1 is our correct option here. Implied consent law, this allows for life-saving interventions. Now option 2, this is incorrect because guys, we're delaying care by calling law enforcement, searching for family. It does nothing to preserve life right now. Now using our 3 steps, let's break this down. This question is asking for the best technique to use for the key problem, helping with general weakness out of a bed and into the chair for the very first time. So before we're looking at the options, I'm thinking safety and ergonomics, or basically, how do you get this patient up in the safest way? So the solution we're looking for is the safest way for the patient and nurse to move for the greatest outcome. So option number 1 is incorrect here. Guys, using 2-person technique is not the best method. Key word there was the patient is weak all over. So they need the full amount of help here. So option number 2 is correct. You need a full body lift because the patient is fully weak and he lacks strength to even move. So option 3 and 4 are incorrect. A standing assist lift is not the best method. Now using our 3 steps, let's break this down. This question is asking for PPE to wear for the key problem. You're caring for a patient with bacterial meningitis. So the biggest thing we're thinking here is droplet precaution. Everything but the N95 mask. So the memory trick we use is droplet precaution. We're thinking PIMP, like that show Pimp My Ride. You're dropping the droplets. So P for pertussis, I for influenza, M for meningitis in this question, and P for pneumonia. Now the solutions we're looking for are ways to prevent the spread of this infection here. So option number 1 and 2 here are correct. A gown protects the clothes from respiratory secretions, and option 2, goggles protects the eyes from those respiratory secretions as well. And option 3 and 4 are incorrect here, guys. There's no need for sterile gloves. And option 4, there's no need for N95 since it's not airborne. Now option 5 is correct here. You definitely need a mask that protects the mouth and nose from those respiratory secretions with that droplet precaution. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now using our 3 steps, let's break this down. This question is asking for the most helpful intervention for the key problem, preventing infection for a peripheral IV catheter. So the biggest thing I'm thinking is how do you keep it safe and how do you keep it clean? So the solution we're looking for are the best ways to prevent the IV from becoming contaminated. So option number 1 is incorrect here. Guys, the IV site should not be changed every 24 hours. Very unnecessary, especially for the pain of always poking that patient. Now, option number 2 is also incorrect. You should avoid very hairy spots. Guys, hairy spots, they hold on to bacteria and can present infection. Guys, we're looking for a clean spot here. Now, option 3 is correct. Strict hand hygiene prevents the spread of infection. And option number 4, scrubbing for 15 seconds. Guys, Scribbling for 5 seconds is way too little. So rule of thumb is 15 seconds here. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking for the most helpful statement for the key problem, fall prevention. So before looking at the options here, we're already thinking well-lit halls and guys, no rugs. So the solution we're looking for are statements that would help prevent falling. So option number 1 is incorrect. Having a full-time caregiver does not directly prevent falls since they can't be there all the time. Option number 2, a walker when you're ambulating may make walking more difficult if you have Parkinson's disease since they're always shaking as they're walking. Now, option number 3 is incorrect as well. Keeping all the lights on day and night is a little bit excessive and can run up the electric bill. So option number 4 is Now, using our 3 steps, let's break this down. This question is asking what instructions to include for the key problem, PICC line care and teaching. So before looking at the options, I'm already thinking, guys, no IV and no blood pressure in that arm with the PICC line. And always keep that PICC line clean because it's a huge risk for infection with any PICC line or even CDC. So solutions we're looking for are correct actions that this patient and this line are kept intact and infection-free. So option number 1 is incorrect. Guys, soiled PICC line dressings need a new dressing replacement. Guys, not just tape. Remember, infection is huge with PICC lines. And option 2 is correct here. Guys, BPs should not be taken on the arm with the PICC line. And option 3, clean the port with chlorhexidine to prevent infection. That's correct. Now, option 4 is incorrect. Guys, medications should never be given in the same line with parenteral nutrition. And option number 5 is correct here. You want to flush unused lines to assess the patency. Just basically meaning that the PICC line is working. Okay, that wraps it up. For more details and Now, using our 3 steps, let's break this down. Now, the question is asking for the nurse's response to the problem of a patient in restraints yelling and threatening. So I'm already thinking therapeutic communication, guys, explore the patient's statements and assess. In NCLEX world, the solution always is assessment. So option number 1 is incorrect. Guys, that's a close-ended response, and it really doesn't explore or assess the statement being made. Now, using our 3 steps, let's break this down. This question is asking for priority action of what to do right now. For the key problem here, an IV pump infusing magnesium is basically alarming as a distal occlusion. So guys, the IV flush is fine, so what do? The biggest thing I'm thinking is that the pump's not working like most of them, right? So the solution we're looking for is we need to ensure that the pump is functioning well and the patient's getting the med right now. So let's break down our options here. Option number 1 is incorrect. It's unsafe to give that magnesium via gravity. If something goes wrong and too much mag enters the system, you can mellow out the system too much, causing respiratory depression. So option 2 is incorrect. Guys, the magnesium should not be discontinued without an order here. And option 3 is also incorrect. Central line is not necessary. Guys, the IV line is working, just the pump's not working. So option 4 is our correct option. Now, using our 3 steps, let's break this down. Now, this question's asking for the best response to the key problem. Patient wants to know if they can take over-the-counter or OTC medications with their prescribed medications. So guys, the biggest thing I'm thinking is we need to verify drug safety. So the solution we're looking for are statements that reflect checking mixing meds before taking them. So option number 1 is correct here. Discussing with the provider ensures mixing meds is okay. So guys, always follow up with a primary care provider first before introducing new medications. Now option number 2 is incorrect. Over-the-counter Now using our 3 steps, let's break this down. This question is asking for which order to contact the HCP. For the key problem, administering medications to a patient, considering safety and legal implications for a chemical restraint. So the biggest thing we're thinking here is medications that are used to restrain the patient. So the solution we're looking for is which medication would need an order from the HCP before giving. So option number 1 is incorrect. Diazepam is used for symptoms of delirium and tremors. And guys, in this patient, it's not a restraint. Now, option number 2 is the correct option here. This is a psychiatric medication that is used for a restraint. So guys, it's not to be used to prevent people from walking or trying to get up. Technically, it's a restraint. Now, option 3 and 4 are incorrect here. Risperidone is used to help with symptoms of schizo disorder. And option 4 is for anesthesia. It's not a restraint here. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now using our 3 steps, let's break this down. This question is asking for interventions to include in the key problem, you're caring for a patient on isolation precautions for VRE in the urine. So we're just thinking contact precautions. So the solution we're looking for are what actions do we include for contact precautions here? So option 1 and 2 are correct here. We gown up and glove up for contact precautions. And option 2, we always wash hands before and after all the care. Now 3, 4, and 5 are incorrect here. Guys, sterile gloves are not used for contact precautions. Surgical masks, again, not used for contact precautions. And isolation for a single room, not a contact precaution. So guys, just remember, when you're in contact with that patient, it's contact, basically meaning touching that patient. Okay, that wraps it up. For more details and Now using our 3 steps, let's break this down. This question is asking for the actions to include for the key problem, initiating seizure precautions for a patient. So anytime you hear seizure precautions, guys, we're thinking safety, padded side rails, and keeping that airway open while monitoring the breathing. So the solutions we're looking for are correct implementations for this patient. So option number 1 is correct. O2 and suctioning is needed. Guys, just think airway and breathing may be compromised here. Now option 2 and 3 are incorrect here. Sheets and pillowcases can remain on the bed for comfort. And option 3, guys, an NG tube or nasogastric tube is not needed for a seizure. Now option 4 is correct. Padding those side rails to prevent injury. And option number 5 is incorrect. Guys, the side rail should be up to protect the patient from this fall. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now using our 3 steps, let's break this down. This question is asking for the priority action, or basically nursing intervention. For the key problem, how do you promote safety in an older patient with restlessness and altered level of consciousness? So the biggest thing I'm thinking is safety measures. So solution we're looking for are priority safety measures for potential fall risk here. So option number 1 is incorrect. Guys, vest restraints are very invasive. There's no indication that the patient needs to be restrained this heavily. Option number 2 is correct. Guys, always we do least invasive to most invasive. So having a sitter that can watch the patient at all times, this ensures patient safety at the least invasive measure. Now, option 3 and 4 are incorrect. Guys, it's good to stay close to the nursing station, but we can't keep an eye on that patient at all times. And option 4, incorrect. Dim lights, guys, that's a big safety risk. If the patient can't see well, then the patient could accidentally fall. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. Now, this question's asking for statements that alerts the nurse to the key problem of a true allergy. So before looking at the options, guys, you should write this down and put this in memory. True allergies are considered anaphylactic reactions, usually involving the airway as well as hives all over the body. So the solution we're looking for are something the patient says that regards to swelling of the airways or something with hives. So option number 1 is incorrect. Restrictions on salts for furosemide, guys, that's just not even related to any type of allergy. Option 2, a migraine with birth control. Technically, that's a normal side effect, not an allergy. So there's no airway or hives here. So option 3, also incorrect. Puffy ankles with prednisone. Guys, remember, prednisone puffs the body. That's a normal side effect. No indication of hives or airway. Now, option 4 and 5 are correct here. So option 4, tongue swelling with peanut butter. Think airway. If the tongue swells too much, it obstructs the airway. And option 5 is the hives with penicillin. Huge allergic reaction. Guys, think hives and airway. Okay, that wraps it up. For more details and test... Now, using our 3 steps, let's break this down. Now, this question's asking for priority action of what to do. For the key problem, patient about to leave the hospital AMA. So the biggest thing I'm thinking is safety. We need to DC or discontinue everything and document. So the solution we're looking for are actions to do right now to prevent that worst possible outcome. So option number 1 is incorrect. Advising the patient is not priority. Guys, they're already leaving now. Now, option 2 is correct. We DC or discharge or discontinue everything, taking out the PIV, the leads, as well as anything else. It's a big safety risk. Now, option 3 and 4 are incorrect. You technically should have a witness, but it's not priority for the patient leaving. And option 4, AMA should be signed, but again, it's not a priority for the patient leaving right now. Okay, that wraps it up. Now, using our 3 steps, let's break this down. So this question's asking for actions to implement for the key problem, reducing catheter association UTIs. So immediately we're thinking clean and sterile. So the solutions we're looking for are methods to decrease this risk for infection. So option number 1 is correct. Guys, we keep the system off the floor. Remember, the floor is dirty, big risk for infection. Option number 2 is also correct. Obstruction in the catheter can cause urinary retention, which leads to a risk for a UTI. And option 3 is also correct. A bag below the bladder prevents reflux of urine, which prevents the risk of a UTI. And option number 4 and 5 are also correct. Guys, perennial hygiene keeps the area clean, reducing that infection risk. And option 5, using that sterile technique when getting samples to avoid the contamination. Okay, that wraps it up. Now, using our 3 steps, let's break this down. This question's asking for the correct info for the key problem, teaching about bed bug infestations here. So the biggest thing we're thinking about bed bugs here, guys, are washing bed sheets and pesticides that are being used. So a solution we're looking for are education that will be most helpful for the elimination of bed bugs here. So option number 1 is incorrect. Bed bugs are not treated with insecticides. The correct treatment is pesticides here. And option 2 and 3 are also incorrect here. Guys, everyone in the home doesn't need to be quarantined, but will need treatment. And option 3 is incorrect. It's not necessary to notify people who don't live in the household. So option number 4 we have to choose here. Washing clothes to help kill bed bugs is correct. And storing in plastic, sealable bags to help prevent infiltration. Okay, that wraps it up. For more details and test tips, now using our 3 steps, let's break this down. This question's asking for the best room for the patient with the key problem, patient that has a flu. So guys, just think influenza for the flu. So we should really be thinking that it's contagious and we have droplet precautions. So the memory trick we use for droplet is the acronym PIMP, because remember that show Pimp My Ride? Droplet precautions. So pertussis, influenza, meningitis, and pneumonia. So guys, the solution we're looking for are appropriate ways to place this client into a room. So option number 1 is incorrect here. A private room is good, but guys, the flu is not contact precautions, it's droplet here. And option 2, once again, private room is good, but the flu is not airborne or contact, guys, it's droplet. And option 3 is correct. Again, private room is good because the flu is on a droplet precaution there. So guys, just remember, now using our 3 steps, let's break this down. This question's asking for the highest priority nursing diagnosis. For the key problem, the graduate nurse is reviewing patient medications on key terms here: torsemide, atenolol, and oxycodone. So guys, the biggest thing I'm thinking is we have a diuretic, we have a beta blocker, and a pain med. All these medications lower the blood pressure. So the patient has a risk for passing out and huge safety risk. So a solution we're looking for is safety, guys, which on the NCLEX, safety is always a priority here. So option 1 is incorrect. Guys, the patient is taking pain meds regularly and PRN for chronic pain. And option 2 is also incorrect. Confusion may be a side effect of some medications, but we have a low likelihood, so it's not really the most important here. And option 3 is correct here. Huge risk for falls, and guys, big safety with these medication combinations. So just think here, we have low blood pressure, and those pain meds can alter the mental status here. And lastly, option number 4 is incorrect. Urinary frequency with a diuretic medication, that's normal. Not really the most important here. Okay, that wraps it up. For more details and test tips, please. Now using our 3 steps, let's break this down. This question's asking for the correct instructions to include, for the key problem, a wet to damp sterile wound dressing change. So the biggest thing we're thinking, guys, wet to damp, sterile, we're thinking sterile and surgical asepsis. So the solutions we're looking for are actions that reflect a sterile procedure. So option number 1 is correct. Hand hygiene is always used before any procedure. And guys, no gloves are needed to open the package here. So option number 2 is also correct. Guys, anything sterile, you should already know, dropping sterile gloves into a sterile field follows asepsis technique here. And option number 3 is also correct here. Keeping the sterile gauze away from the drape edges follows correct surgical asepsis. And option 4 here was incorrect. Guys, it's never safe to use an unlabeled open bottle of sterile saline. Anything sterile has to be closed, has to be locked, and follow normal medication procedures here. And option number 5 is correct, guys. You should never turn away from a sterile field because you can't assure everything will stay sterile. Okay, that wraps it up. For more details and test tips, please see the rationale. Now, using our 3 steps, let's break this down. Now, this question's asking for assessment findings with the key problem, potential allergy risk to latex. So before looking at the options, you should already be thinking any type of history of allergic reactions to latex, as well as key terms here. Allergies to apples and avocados may mean allergy to latex. So the solution we're looking for are items that could indicate the patient is allergic to latex. So option number 1 is incorrect. An allergic reaction to losartan is not related to latex. Now option number 2 is correct here. Allergic reaction to apples and avocados could mean a reaction to latex as well. And option 3 and 4 are incorrect. An allergy to CT contrast, not related to latex. And option number 4 is incorrect. History of catheter-induced UTIs, not related to latex. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking for the priority action here. So basically, what's the most important thing to do for the key problem of a 12-week-old with suspicious wrist fracture? So guys, the first thing we're thinking, and I'm thinking at least, is abuse. And the patient should be in a crib if they're 12 weeks old. Guys, shouldn't be in a bed here. So the biggest solution we're looking for are things to keep that newborn safe. So choose actions to do right now to prevent that worst possible outcome. So our first 3 options are incorrect. So option number 1, asking where the baby sleeps. Guys, that's really not helpful because the question already told you the baby was in the bed. Option number 2, it's important to record the info, but technically it doesn't protect the baby right now. And option number 3 is also incorrect. You cannot prohibit the parents from staying with the baby. Now, if you chose this, then it was a good try, because if you're suspecting abuse, you don't want to leave the abused parents alone with the baby. But guys, not appropriate right now. So the correct option is number 4. Suspicious of abuse, you guys, you should report to the proper authorities. Remember, nurses are mandatory reporters here. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. Now, this question's asking for the appropriate nursing actions for the key problem, patient admitted with VRE in the urine. Technically, it's contact precautions. So solutions we're looking for are actions that have to deal with contact precautions. So option number 1 is incorrect. Equipment needs to be cleaned with approved disinfectant, like chlorhexidine. And option 2 is correct here. Gowns are needed for contact precautions. And option 3 is correct. Visitors need PPE for contact precautions. Now 4 and 5 are incorrect. Washing hands before and after all patient care. And option 5, N95 is not really for contact precautions. Now lastly, option 6 is correct here. Gloves are needed for this contact precautions. Remember, if you're in close proximity and may come in contact, then it's contact precautions. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question is asking to choose a patient for the key problem, the highest risk for getting a hospital-acquired infection. So, biggest thing I'm thinking about infections at the hospital is advanced age, someone who's immunocompromised with low WBCs, or someone who's been there in the hospital for a long time. So the solution we're looking for is a patient who has the greatest risk factors for infection. So option option number 1 is incorrect. This patient is middle-aged and just had surgery 1 day ago. So guys, not a lot of risk factors here. And option 2 is incorrect. Again, we have a middle-aged patient being treated for asthma, so not really a big risk here. Now, option 3, we have our advanced or older age patient who's unresponsive and has a catheter. So guys, the biggest thing I'm thinking about is a UTI with that catheter. So option 3 is correct. Now, option 4 is incorrect. An elderly patient who was admitted 6 hours ago getting fluids. Guys, not a lot of big risk here. Okay, that wraps it up. For more... Now, using our 3 steps, let's break this down. So this question is asking for standard PPE to use for the key problem. Guys, patient has an active TB or tuberculosis infection. So we're thinking airborne infection, you need an N95 mask. So the memory trick we use is it's on air with MTV. Airborne's for measles, TB, and V for varicella, or basically chickenpox. So the solution we're looking for are protection from airborne transmission. So remember, on air with MTV here. So option number 1 is incorrect. Guys, a gown doesn't protect against airborne transmission. Now option 2 is close, but it's incorrect. A face mask is not used to protect against airborne transmission. And option 3, face shield. Now, using our 3 steps, let's break this down. So this question is asking, choose an IV site for the problem, least risk for infection. So I'm already thinking distal spots and easy access. So the solution we're looking for are site that involves the least amount of infection risk. So option number 1 is incorrect. Guys, the basilic vein in the forearm is right next to the AC area, so when the arm flex, it can irritate the vein and catheter, causing an infection. Now, option number 2 is incorrect. The cephalic vein on the wrist. Think of flexing, guys. You can irritate the vein and also cause infection. Now, option 3 is the correct option here. The dorsal flat surface on the distal part of the arm. Guys, that's easy to access and away from the common infection here. And option number 4, guys, an IV on the saphenous on the foot. Guys, we're not even thinking about foot IVs because that's high risk for infection. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question is asking to select a patient for the key problem, which patient needs written orders for restraint. So before we even look at the options, I'm thinking anything considered a restraint needs an order. So the solution we're looking for are which scenario is the patient being restrained here. So option number 1 is our correct option. Hand mittens are technically a form of restraints. If you guys didn't know that, then please write that down. Big NCLEX tip right there. Now option 2, 3, and 4 are incorrect here. So option 2, a knee immobilizer is supposed to immobilize the knee, so it's not a restraint. Option 3, padded side rails for a patient with a seizure. Guys, that's okay. Only if the question stated 4 side rails up, that's considered a restraint. So option number 4, 2 side rails up, that's fine. Remember, 4 side rails up is the restraint here. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question is asking what to report for the key problem here, assessing patients scheduled for a radical prostatectomy. So our biggest things that we're thinking about are contraindications to surgery. So we're thinking safety here with this prostatectomy. So a solution we're looking for are findings that would interfere with surgery here. So option number 1 is correct here. Febrile and green sputum, guys, huge indications for infection. And option 2, 3, and 4 are incorrect, since these laboratory findings are normal here. So guys, just remember, know your lab values for the NCLEX. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question is asking for the most critical finding for the key problem of oral surgery. So guys, before we're looking at the options here, oral surgery, you should be thinking already dental surgery contraindications. So dental surgery, I'm just thinking bleed risk and antibiotics before dental procedures. Huge risk for our heart valve replacement patients. They need those prophylactic antibiotics. So the solution we're looking for are items that could be a problem with dental procedures. So option number 1 is incorrect. Guys, the BUN is within normal limits here. Now option number 2, big red flag, that's correct. Mechanical valve replacement, increased risk for endocarditis. That patient needs antibiotics first, and they might be on blood thinners as well. So option 3 and 4 are incorrect here. History of cabbage does not really affect oral surgery. And option 4, a healthy diet does not affect dental procedures either. Okay, that wraps it up. For more details and test tips, please. Now, using our 3 steps, let's break this down. This question is asking for the correct actions to implement for the key problem, fall prevention. So before looking at the options, I'm already thinking activate that bed alarm, put up fall signs, and even well-lit halls, and guys, no rugs, but technically for the home. So the solutions we're looking for are ways to reduce the patient's risk for falls. So option number 1 is incorrect. Guys, never deactivate an alarm for a patient who is at risk for falls. You can't hear if the patient's getting up out of bed, and the patient might fall without you noticing. So option 2 and 3 are correct. Non-slip socks prevent slippage and fall. And option 3, identifying the patient as a fall risk makes everyone on the care team aware that this patient's at risk. And option number 4 is incorrect. You don't want that patient to be alone or far away from the nurse's station. You can't monitor them, so it's pretty much unsafe. And option number 5 is correct. Guys, we always keep a bedpan close to the patient so it's in reach, so the patient doesn't feel like they have to get up. Now, using our 3 steps, let's break this down. This question is asking for what to do for the key problem the provider prescribes more morphine than is recommended. Guys, we're thinking huge safety here. If you guys don't remember anything for your medication or how much is supposed to be ordered, just let the question help you here. So the solution we're looking for, preventing errors from being made and keeping that patient safe. Guys, too much morphine, it makes everything low and slow, leading to respiratory depression and even death. So option number 1 is incorrect. Scripts should be checked with who wrote it, not the charge nurse, because the charge RN cannot change it. Option 2 is incorrect. The med shouldn't be given when in conflict with dosaging, guys. Always question anything that comes into patient safety. So option 3 is correct here. You call that provider to review the correct order before giving anything that would harm the patient. And option 4 is incorrect here. Assessing the patient's usual dose and tolerance doesn't change the potential medication error here. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question is asking for transfer methods to use for the key problem, patient who's able to bear partial weight and follow simple instructions. Guys, those are really big keywords there. So we're immediately thinking, guys, they need some assistance, but not full assistance. So a solution we're looking for are correct ways to move this patient. Remember, keywords, bearing weight, and they can follow instructions here. So option number 1 is incorrect. Guys, they don't need a cane and a person to help. Only one person can help here. Now option 2 is the correct option. One person can help, remember that. They can stand and pivot, and this provides more control. Now option 3 and 4 are incorrect. Guys, 2 people are not needed. If the patient can partially bear weight, then they can only have one person. Or basically, one person is adequate. So option number 4, guys, 3 people are not needed. This is incorrect. The patient has the ability to help with the movement here. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking for the wrong action. For the key problem, the nurse is watching a student who's providing wound care to a patient with cellulitis of the arm. So immediately we're already thinking swelling, pain, and redness to that cellulitis on the arm. So the biggest solution we're looking for, guys, we're looking for the incorrect options here from the student. So option number 1, we have to skip because contact precautions are used correctly to prevent that spread of infection. So guys, remember, we're looking for the wrong things here. Option number 2, we also have to skip. Outlying and dating helps monitor the spread of the infection and that affected area. Now option number 3, we have to choose here. Guys, putting the arm flat increases edema. Remember, cellulitis, we have to lift the arm here. So option number 4, we have to skip. Guys, warm towels vasodilates, which actually brings healing to this affected arm here. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking for the priority action, or basically what to report for the key problem, patient with a history of MI who's scheduled for a bronchoscopy. So guys, the biggest thing we're thinking about is a contraindication to the procedure, as well as keeping that patient safe. So solution we're looking for here is keep the patient safe. So which statement would lead to the worst possible outcome here? So option number 1 is correct. No aspirin within 3 days, guys, that's cutting it really close. So big risk for bleeding. Key NCLEX term you should write down is 5 to 7 days before surgery. Anything that thins the blood should be discontinued. Now option 2 is incorrect. No medications for achy joints. Guys, that's likely anti-inflammatory aid, which is okay because there's no bleed risk there. And option 3 and 4 are incorrect. Nicorette gum doesn't include a risk for bleeding. And option 4, you should take MVI, but guys, it's okay for surgery. No risk here. Okay, that wraps it up. For more Now, using our 3 steps, let's break this down. This question's asking for infectious control measures to implement. And the key problem, you're caring for a patient with hepatitis C. So the biggest thing I'm thinking about for hep C is viruses that spread through blood, and we're using standard precautions here. So the memory trick we use for hepatitis B and C, just think blood cultures B and C, since hepatitis B and C are spread via blood. So solutions we're looking for, guys, are the correct protection for this hep C bloodborne illness. So option number 1 is correct. Gloves are standard precautions that prevent contact with blood. Now option 2 is incorrect. Guys, gowns aren't necessary. We're just talking about standard precautions here. And option 3, we don't need sterile gloves, so it's not necessary, incorrect. And option 4 is also incorrect. You don't need an N95 mask. You just need standard precautions, which is our gloves. And option 5 is correct. Hand hygiene is necessary. So, guys, always hand hygiene is usually a correct option here. Okay, that wraps it up. For more details and Now, using our 3 steps, let's break this down. This question's asking when to intervene for the problem a nurse is watching a student do a sterile dressing change. So guys, the big key word here is sterile dressing change. So we're just thinking surgical asepsis. So the biggest solution we're looking for are which actions are incorrect here. So option number 1 we have to choose because it's technically incorrect here. So guys, no sterile gloves are used, only regular gloves to remove the dressing first. And option 2 we have to skip because remember we're looking for the incorrect options. We always wash our hands before and after any care really. And option 3 we have to choose. Guys, we never save open, sterile, anything. Once it's open to air near the patient, it's not sterile anymore. And option 4 and 5 we have to skip since they're the correct things to do. So the outermost edge to open so you don't contaminate the sterile product, that's correct. And option 5,